Hi everybody, I'm Kenneth Adams, cardiologist at Pentucket Medical. This is a special day for me. Every year on this particular day I reflect on what's happened over the years at Pentucket Medical. This is now my 30th anniversary at PMA. And as I reflect, I remember that I was the 10th doctor to join this group back in 1984. And I was actually the first cardiologist in this part of the Merrimack Valley. All 10 physicians shared a relatively small office building on Summer Street, and after a while we were really bursting at the seams. We all had paper records. We had the charts with the papers, falling out when you were trying to review things when the patient was in your office. As I think about that, I think about how things are now. Now we have 5 cardiologists in our group with different specialties. Pentucket Medical as an entire group is now spread over 3 major sites and 2 or 3 smaller sites, and we have a total of 80 providers, so 8 times as many providers as we had back in 1984. We have a strong relationship with tertiary care facilities. We have a very strong relationship with Partners Healthcare, which includes North Shore Medical Center, Massachusetts General Hospital, Brigham and Women's Hospital. We now have an electronic medical record, which we've been using now for almost 10 years. So we have every patient's record available to us just as we carry our laptops around. So it's great for patient information, for retrieval of information, for recording data, for keeping things up to date. Another thing I reflect on is how much we've been driven toward quality. We have a number of quality measures that we try to achieve every year to show how well we're providing care for a number of different illnesses, including diabetes, cholesterol issues, a number of things. A new development for us is something we've been working on for the past year or two. It's a new concept. Many people don't know about it. It's called Patient-Centered Medical Home. And I think the name tells you what that's about. It's putting the patient at the center of the healthcare team. So what we've been doing is reorganizing the way we deliver healthcare. We're trying to make our offices much more accessible. We always felt they were accessible. We want to make that even better. We want our care to be proactive. So in other words, we want to think ahead about what you might need. We want all our staff members to work together as a team, and that goes from the receptionist to the medical assistant, to the nurses, to the physicians, to the reception staff, to the laboratory. We want everybody working together as a full team. So again, this will be patient-focused, it will be teamwork, and it will be proactive to try to meet your needs and help manage the situation going forward. So tremendous amount of changes in the past 30 years. As I think about it, I'm really amazed about all the things that have happened and how quickly they've happened during just the course of my career. So I thank you for listening, and I hope you can also appreciate how much things have changed. Thank you.